This is a real space. We already own it. With the right equipment and a lab technician, this room becomes faster diagnoses, earlier treatment, and better outcomes. Now, tools don't replace faith, but they do strengthen what our doctors are already doing. And to help explain why this matters medically, I've actually invited my sister, Dr. Donna Paris, to come and share with us today.
Hi there. How's it going?
Hi.
Thank you for being here tonight. I really do appreciate it. Um, so let's just start. Can you share a little bit about your background and your experience?
I have about 35 years of experience in cardiovascular nursing. Every dynamic from the ICU to rehab, I've done it. And then about 16 years ago, I began working in academia. And after obtaining my doctorate of nursing practice, I now teach in a school of nursing in West Texas.
Excellent. So, what drew you into medical missions?
I've always had a passion for helping others and an interest in serving on the mission field in a medical capacity. This became a reality when a call went out from my church that they needed medical personnel who would be willing to help in Honduras following Hurricane Mitch. I don't know if many of your listeners remember Hurricane Mitch, but it completely devastated Honduras. Tens of thousands of people were killed in the aftermath of the hurricane, and it completely wiped out the infrastructure of the country. Incidentally, I have also served in the Amazon Basin region of Peru, and we went from village to village providing medical care for individuals there that never had seen a doctor in their life.
Wow. So, obviously, you've seen it. When you hear about a place where people don't have quick access to medical care and medical testing, what goes through your mind as a medical professional?
Well, without rapid labs or imaging, care relies much more heavily on history taking, on the physical examination of the patient, and upon the provider's clinical judgment. Providers have to recognize very subtle signs and symptoms and use differential diagnoses a lot more carefully and monitor changes over time rather than confirming things immediately with tests. Now, when I was in Honduras, especially in the early days of our mission work there, um, we were not, we were only there for a couple of weeks at a time. Now, gradually, over a period of years, uh, our medical clinics became much more well established, and we were able to have labs drawn and run there in our labs. But I can tell you from experience that those who are currently working in Haiti, it's a blessing that they have providers that are there that can follow individuals over time and look for these subtle clues.
So, what are some things that might start small, but then can become serious if either care is delayed or if they don't have testing to tell them exactly what's happening?
Limited testing can mean several things. As you just mentioned, delayed diagnosis is one. And so, what that means to the individual is that we can have a progression of the disease before actually confirming what's going on with the patient. And then that in turn leads to potentially worse outcomes for the individual. We think about the conditions like diabetes, kidney disease, or electrolyte imbalances. These are much harder to detect early if we don't have lab work.
And how are those things tied to nutrition? And how does that lead to overall condition of health? And how's that connected to diagnosing that in kids or in adults for that matter?
Well, nutrition is foundational to a child's health. It supports great growth and brain development, the immune function, and even emotional well-being. And it also shapes long-term health outcomes so that those who are children now grow up to be healthy adults later. Nutrition and health in children are deeply interconnected because the body and the brain are rapidly growing throughout childhood. Adequate nutrition doesn't just provide energy to the child, but it supports physical growth, brain development, the immune function, and as I mentioned earlier, long-term health outcomes.
So, if those core problems are existing and they're either malnourished or undernourished, and then they get sick, what happens next?
Depending upon the disease, they may have a very poor outcome as a result. Children must have sufficient calories and protein, vitamins, and minerals in order to support normal growth. So during infancy and childhood, even adolescence, the body is building things like bones and muscle and organs and tissues and all of those things. And so when nutrition is inadequate, children can experience stunted growth, delayed puberty, reduced bone density, and things like that. The brain develops early in life, especially during the first few years. And so nutrition supports cognitive development, memory, attention span, and language development.
Now, I know that you experienced a lot of different things, both stateside and then when you were doing your mission work. But did you ever care for a child that didn't receive help early enough?
Probably one of my most vivid memories was working with a 12-year-old girl in Honduras. Her name was Maria. And when I became acquainted with her, she was living in the home of a missionary because her parents, who lived in the higher elevations in the mountains of Honduras, had abandoned her because she had 14 brothers and sisters and she was not able to contribute to caring for her younger siblings. And because she could not contribute to the household, they left her with the missionary in Catacamas. Now, Catacamas was at the base of the mountains, and so she also was able to function better in the lower elevations. What was wrong with Maria was that she had a congenital heart problem. And this is a problem that would have required surgery at birth. It was amazing that she lived to the age of 12 and that she did so without surgery. In the US, her illness would have been fixed very quickly. It probably would have been diagnosed while she was still in the womb, and preparations for surgery would already be ongoing in order to help her live.
Wow. So, how does something like that stay with you as a provider?
I would guess it's probably been 2 decades since I saw Maria. She died about 6 months after my last mission trip, and I still remember every interaction I had with her. She was just so full of joy.
That's heartbreaking. um, what do you wish more people understood about situations like this?
Don't take healthcare for granted. It's important for good health and for individuals to have proper nutrition. That does begin in the home. When we can supplement that, that means it's all the more valuable to younger children. It's important for them to have regular checkups and easily accessible labs and other diagnostic testing.
So, on the flip side of this, when a patient receives timely care and they have proper nutrition, what's the difference that you see?
There's a world of difference. When a country reports life expectancy changes dramatically once childhood is over. The biggest challenge for individuals in life are in the first few years. So basically, the longer you live, the longer you live. Globally, the biggest challenges we face are that there are so many third and fourth world countries in which children die of malnutrition. And for those to be able to survive the malnutrition, then they're dealing with developmental delays. Sometimes those are quite serious. So the first 1,000 days are the most important for a child to be well nourished. Basically, that time frame means it's from conception to about 2 years of age. And if they don't get proper nutrition, that does include the pregnant mothers, then these problems rapidly become irreversible.
Hmm. So, when you went into these countries, did you ever think if they only had this tool or that tool, it would be a complete and total game changer?
Absolutely. Faster testing and earlier diagnosis could make a significant difference in the health and the survival of children in places like Haiti, Honduras, Peru, where access to laboratories and specialists and advanced medical equipment can be quite limited.
Hmm.
So, when clinicians identify illnesses early, treatment can begin sooner, and this often prevents complications and improves long-term outcomes.
Well, I want to thank you so much. Thanks for your time. I know you've got a really busy week, and I just appreciate you for not only sharing your expertise, but your heart today. So thanks. See you later.
Thank you.